is on, less than 2 hours away now from the long-awaited health care summit in Washington. But will lawmakers' ideas really be heard at the bipartisan meeting? Joining us for a fair and balanced debate are House Minority Whip Eric Cantor and House Majority Whip James Clyburn. Good morning, gentlemen.
Good morning. Good morning, Gretchen.
All right, Congressman Clyburn, the president's going to kick this thing off 10 a.m. Eastern time. Do you expect him to come carrying an olive branch?
Well, I think the president will continue the discussion that he started with Republicans some weeks ago when he went to their conference. I think that he will, as he already has, will lay his things on the table and ask them to modify, improve upon, or explain why they would like to detract from. I think it will be a very open discussion. And we will all leave there, I hope, with a better understanding as to why the other side see things the way they do.
Congressman Cantor, doesn't the president already know what the Republicans want in any kind of health care reform?
Gretchen, I would think that the president would know where we stand already, but the problem is he has demonstrated that he doesn't know where the American people stand. You know, we wouldn't be having this conversation today if the American people were behind this bill. The problem is we've been cut out of this process a long time ago, and so have the American people. You know, the president has very laudable goals, but the bottom line is the people are not buying that his bill will accomplish what everyone wants, and that is better, more affordable health care. It's just an unsustainable path that the president's bill will set us on.
We also wouldn't be here today if Scott Brown had not won the election in Massachusetts. By all accounts, health care reform probably would have passed. Congressman Clyburn, Congressman Cantor points to the polls, and a recent one shows that 48% of the American public at today's meeting, they want to scrap the entire original plan and start over. Are Democrats going to listen to those 48% of Americans who feel that we should start over?
I think that we will listen to those 63% of the American people who say that we cannot sustain the current course and we need to do something about reform in health care. And I would ask Mr. Cantor, which plan is it that 48% is against? Because the last time I checked, the president has laid out some proposals. He has not laid out a plan. We House members laid out a plan. The Senate laid out a plan. They are different plans. Now, which one of those plans will that 48% be speaking to?
Well, the president
so I think
did.
That we're being
no, but the president
disingenuous here.
Congressman, with all due respect, well, with all due respect, the president did lay out his plan. It's an 11-page primer that you can find on the website right now.
It is a primer, but it's not a legislative plan that the people are reacting to. So these proposals that the president has laid out are very, very much supported by the American people. Getting rid of pre-existing conditions, getting rid of rescissions when people have catastrophic illnesses, getting rid of co-payments that are too high.
Right.
This is what the American people would like to see us do something about, and that's what you find in the president's proposals. And I doubt very seriously that they are opposing that.
Congressman, quite frankly, the American people may agree with some of those things, but Congressman Cantor, the one thing the American public seems to not agree about is the cost of this whole thing, and that's what the Democrats, try as they might, not want to talk about.
Well, and Gretchen, we know that the White House, Gretchen, we know that the White House has admitted that the president's plan, as reflected in those 11 pages, is essentially the Senate bill with what they said were some strategic changes. We also know that the cost of the Senate bill has been increased under this president's plan to $900 billion, almost $1 trillion now. So the public, I do think, understands that this bill, this proposal, is something that they don't have faith in. That's why I hope when we go there today to this summit that we can see that the president will start listening to the American people and begin to say we need to be much more modest in the approach in a common sense way to try and do something to bring down health care costs so that people can maintain the health care that they have, that they enjoy.
All right. Well, both of you will be at that meeting, and all eyes will be on you and the president. Congressman Cantor and Clyburn, thank you for being my guest this morning.
Thank you so much for having us.
Thanks, Gretchen.